Good afternoon, everyone. Thanks for joining us. My name is Rafael Espinal. I'm the Executive Director of Freelancers Union. First and foremost, I hope everyone is doing well on your end through this pandemic. I want you to know that we as an organization are doing everything we can to advocate for you, not only locally, but on a federal level to ensure that we have a very comprehensive COVID relief package that is going to deal with the issues you're facing financially, emotionally, and even through your health as well. Most importantly, today we feel it's a very important day and a very important stream and event because it's an opportunity for you to hear from one of the carriers that we recently created a partnership with to provide you with very affordable health insurance. We as an organization know the importance of not only of you being covered, but also whether or not it's affordable for you. We believe that historically healthcare has been extremely expensive, which is why early on in the creation of this organization, we worked to create our own health insurance carrier in which freelancers were able to buy in and get more affordable health insurance than what was out there in the market. But now we're working with this great group called MetroPlus. They are affiliated with the city of New York. They are part of the city's public health network. So this is a carrier that we know not only will provide you with affordable health care, but also provide you with some of the best health care the city has to offer. And that's in our New York City's health and hospitals. So with that said, I'm going to allow them to come on and speak to give you an overview of who they are, the services they provide, and why they are the best health insurance carrier for you, especially given this moment in our time. We thought it was important to work with more affordable carriers. So when you go and sign up this year, you'll see some changes in our options. But we chose MetroPlus because we know the work they've done in the past, and we know that they're going to be a great carrier for you to carry on moving forward. So with that said, I would like to invite Carlos from MetroPlus to come on and say a few words, but also walk you through the offerings, the great offerings MetroPlus has.
Thank you, Rafael, for that great introduction. Really appreciate that. We're excited here at MetroPlus for this partnership. It's a new partnership, so we look forward to working together and serving your members. What I'm going to do now is give an overview and talk a little bit about MetroPlus, and then I'll transition to the slides and just to manage expectations, go over the agenda, and then I'll hand it off to my team, which includes David Jacobson and Brian Enger. So to talk a little bit about MetroPlus, MetroPlus has been around since 1985, so that's a little bit over 35 years, and we're known for providing affordable healthcare and access to healthcare. We currently have close to 600,000 members within our health plans. We have a diverse set of health plans that we offer New York City residents and people who work in New York City. So we pretty much offer health plans to anyone. We have a diverse set of health plans regardless of age. We have health plans for small businesses and even city employees. We also have diverse services. What does that mean? We take pride in saying that we're not just a health plan. We don't just pay for claims and cover your services. What we do is we work with your primary care provider, with your specialists, with other partners, with your family to deliver the best care for chronic conditions, to help you get involved in preventive services. So that's something we're very proud of. We also have a strong, diverse geographic reach. We have over 30,000 provider sites within the 5 counties of New York City. And we are very proud of the fact that we also have a diverse staff. We have staff that speak over 40 different languages. And I want to point out the fact that we are not-for-profit and we are part of New York City, like Rafael mentioned. And I would like to highlight that the fact that 95% of our staff are also union. So why do I say that? We understand the role and importance of a union, like Freelancers Union. Next, I'm going to put up the slide and share my screen, so give me a second to transition. Okay. For the agenda for today, we're going to talk about open enrollment for 2021. The first two topics is New York State of Health open enrollment and the overview of MetroPlusHealth products. David Jacobson will cover that. We'll also cover the overview of tax subsidies and access to tax subsidies. Brian Ettinger will cover that. And again, we plan to cover this within the next 15 to 20 minutes. It's a basic overview, hoping that you will acquire some information and also encourage you to reach out to us and get into the details of what our health plan can do for you. So I'm going to stop here and I'm going to hand over the presentation to David Jacobson.
Hi, everybody. My name is David Jacobson. Like Carlos says, I'm one of the sales account executives at MetroPlus. So I'd like to go over basically with you the overview of MetroPlus's products. So if Carlos, please, next slide. Okay. So basically, open enrollment for 2021 started on November 1st. It ends January 31st, 2021. Now, based on when you enroll, you'll either get, if you roll before December 15th, you'll get a January 1st, 2020, January 15th, February 1st, and anything after January 15th, March 1st, 2021 effective date. And you're good for 12 months. Next slide, please. So basically, the product overview is MetroPlus, like Carlos said. We offer a variety of products across multiple class of people. One of the plans first that we offer in the marketplace is our QHP products. It's Qualified Health Plan. We offer 4 products, Bronze being your high deductible plan, Platinum Plus being the just straight copay plan, and the 2 plans in the middle are just in between. They're copays and deductibles. We also offer Essential Plan. This is on plan basically depending on your income, and Brian Ettinger, one of my colleagues, will go over this. Based on your income, you'll either have a $0 copay or a $20 copay. And for additional cost, we do offer dental and vision for an extra $20+ a month. So that would be like $43.77, I believe. We also offer Medicaid managed care products, child-only health plans, Medicare, and also special need products like managed long-term care, HARP, and other plans. Next slide, please. So the product spotlight, as I mentioned before, one of the plans we offer on the left is the Essential Plan. Now, this is the rate for 2021. Again, like I said, for additional fee, you could get dental and vision. For our QHP products, depending on your projected income, there might be subsidies that will go towards these plans. And then other than that, that's it. Next slide, please. So the product spotlight. So we offer MetroPlus Silver is basically one of our highest rated plans. It meets a lot of our consumers across the board, and we're very proud of that. And we also offer a gold plan. Our gold plan for 2021 is just slightly lower in deductibles and in copays, but both are what I like to say are middle plans between the bronze and the platinum. Next slide, please. Other than that, this is Brian Ettinger. He's one of the sales account executives, and Brian will go over the details on the annual income, projected annual income for 2021 and what you might qualify for.
Thank you, David. I am Brian Ettinger. As David said, I am a account executive on the commercial team at MetroPlus, of which myself and Carlos and David and a number of others are on that particular team. And I'm going to go over the tax subsidies that are things on the New York State of Health you may be eligible for based on your income. Now, David had talked about a couple of other plans, Medicaid, Essential Plan. If you make up to a certain amount, you'd be eligible for those plans, and the tax subsidies wouldn't come into play with those particular plans. So the tax subsidies I'm going to discuss are for the qualified health plans, and if you're not eligible for Medicaid and the Essential Plan. Next slide, please. So there's two types of tax subsidies that we're going to discuss today. The first one being the premium tax credit, which we're going to talk about now. The premium tax credit is a tax credit. It's called the Advanced Premium Tax Credit on the New York State of Health. And that is an amount that's deducted right off the top of the costs of the premium for the health plan. So that's the upfront cost. Then we're going to discuss cost sharing reductions, which are back end tax credits for when you actually use the plan. And those cost sharing reductions apply to deductibles, copays, co-insurances. So first, we're going to go over the premium tax credit. Again, you have to apply for these tax credits on the New York State of Health website, which is the Affordable Care Act exchange here in New York. Some of the other states in the area here have their own exchanges, and otherwise there's the federal healthcare.gov site. But we specifically are in New York, so we're going to discuss the New York State of Health tax credit. So again, you have to apply on their website, and there's a couple conditions you have to meet to be eligible for the tax credit. You have to be between 100 and 400% of the federal poverty level for 2021, which is based off of 2020 poverty guidelines. So what that means to you is if you make between $12,760 and $51,040, and that's what you estimate to make for 2021, you may be eligible for this premium tax credit. That's on an individual basis. For a family of four, it's $26,200 up to $104,800. And there's everything in between. You could be a family of two, family of three, family of 10. There is a different range for those size families, but we wanted to highlight individual and family of four. Those are the most common. So other than the income level, you have to not have access to affordable coverage through an employer or a family member's employer. And also, as I had mentioned before, you have to be not eligible for Medicare, Medicaid, Child Health Plus, or other public assistance. Next slide, please. So this is just a quick visual representation of what I was just discussing with the income range. I'm not going to dive too deep into this, but you can see on the right-hand side, 2021 federal poverty level of 100% is $12,760 for the individual, and 400% is $51,040. If that's your estimated income for 2021, you may be eligible for these premium tax credits. And then on the far right, you can see family of four, again, between $26,200 and $104,800 as your estimated 2021 income. You may be eligible for those premium tax credits. And again, you'd have to fill out an application on the New York State of Health, which we will go over later. Next slide, please. So to do a quick example here, to give you an idea of how this works, we put an example together, completely fictional example here of someone who's an individual who's at 250% of the federal poverty level for next year, 2021. So that would equate to about $31,900 per year, as you can see. So the tax credit is based off the second lowest cost silver plan. So in our example, that plan in the marketplace costs $500, just for nice even numbers. So under the Affordable Care Act, which is what all these subsidies are based off of, if you have an income of $31,900 per year, your cap on how much you should be spending for your health insurance coverage is 8.33% of your income for, again, the second lowest cost silver plan. So that means that this fictional person, Pat, would pay no more than $221 per month for, again, that second lowest cost silver plan. So therefore, the tax credit would be $279 per month, which is the $500 premium minus the $221 cap. So the good news is, at least with the premium tax credit, you don't have to apply that only to the silver plan. You can take your tax credit and apply it to either the bronze, silver, gold, or platinum plan, which again, those are the qualified health plans if you're not eligible for Medicaid or the essential plan. And also good news, you're not going to have to figure out any of this math. So when you do your application on the New York State of Health, which is something David and I can help with, we are assisters/brokers on the New York State of Health. You basically fill out your basic information and any members you have in your household, and put your income information, and then New York State of Health tells you on your eligibility page what kind of tax credit you're eligible for, if you are indeed eligible for one. Next slide, please. The second tax subsidy we're going to go over is cost-sharing subsidies. So again, the premium tax credit comes right off the top of the cost of the premium. The cost-sharing subsidies are a second form of assistance, and they will help you on the back end when you actually use the plan. These cover out-of-pocket costs such as deductibles, co-pays, co-insurances, and unfortunately with this plan, unlike the other plans, or unlike the premium tax credit, you have to use the cost-sharing reduction on the silver metal level. So essentially what it's trying to do here, what the law is trying to do, is increase the actuarial value of the silver metal plan. So making it look more like a gold or platinum plan with those lower deductibles and co-pays for the cost of the silver plan. Next slide, please. So here's a visual representation of what the cost sharing reduction looks like. For us, we have the Silver Prime and the Silver Plus plan. Right here, we have listed our Silver Plus plan. So if you're between 100 and 150% of the federal poverty level, you could get the Silver plan if you're eligible for the cost sharing reduction. And it looks more like a platinum plan with a $0 deductible, low max out of pocket, low copays. If you're between 150 and 200% of the federal poverty level, you can get a $250 deductible, again, low max out of pocket, low copays. And if you're between 200 and 250% of the federal poverty level, you can get a slight cost sharing reduction. It's going to look a little similar to what the Silver Plus plan would ordinarily be, which is a $1,300 deductible, but still a little bit lower on the deductibles, max out of pockets, and copays. Next slide, please. So there's three ways to apply for the subsidies, again, on the New York State of Health website. First, you can have an assister help you. Again, that's what myself and David are. We are assisters on the New York State of Health. I think later on we'll be able to drop our contact information in the chat if you'd like to get in touch with us. But at MetroPlus, we also have dedicated assisters, a couple hundred of them. And the number here to call them is 1-855-809-4669. 4073, and you press the number 3 and you'll get in touch with one of our other assisters. The second way to apply on the New York State of Health is to call them directly. Again, we'd prefer you, if you decide to sign up with Metro Plus, to call the number here and speak with our dedicated assisters. And then lastly, you can do your own application on the New York State of Health. So let's take a look at how you can compare the different plans. Next slide, please. Before you sign up on any plans, of course, you want to compare them, make sure it's right for you and any dependents or family members you might have. So you can go on the Freelancers Union website, which is www.freelancersunion.org/insurance/health. And when you go on that particular site, under the Health tab, you click on the link Shop Health Insurance. That's where you will find the Metro Plus plans to compare. Next slide, please. If you do decide you want to sign up with Metro Plus, we would be most overjoyed, and you can sign up right on our website. We do have an enrollment tool directly on our website, and that is enrollment.metroplus.org/home. And on that website, you can create your own account if you like, start your own application. As you see under the A arrow here, you would need your own email address, and you create a password, and basically you complete an application, and a member of our team will get back to you within 24 hours. And if you are eligible for any of the subsidies we talked about, we will help you claim those subsidies for your plan. If you need to get in touch with someone sooner, and or you just have questions in general for our team, on this particular website, again, enrollment.metroplus.org/home, you see the B arrow there. It says click here. That gives a link to all the contact information for our team. You can call us with any questions you might have, or assistance to enroll, and again, claim those subsidies we went over. Next slide, please. So this is what the front page looks like. If you decide to do the application on your own, there are somewhat look like upside down exclamation points next to the fields that are required, such as your name, address, phone number, those sorts of things. You can click on that upside down exclamation point, and it'll tell you what exactly is needed and why in that particular field. And once you complete all the required fields, you hit save and next. You keep going to the end. You submit the application. And again, someone from our team, we are checking every day this repository that holds the applications. And we will get back to you within 24 hours to discuss your application and any subsidies you might be eligible for. Next slide, please. So we hope you found our presentation informative today, and we hope that we showed why Metro Plus is the best option for you and any dependents or family members you might have. We're happy to answer any questions at this time. I know we went over a lot. Again, you can get our team contact information on our website. We'd be happy to help you any way we can. Thank you.
Well, I just learned I was muted. I'm sorry, everyone. Well, Brian, Carlos, David, I really just want to thank all of you again for the presentation. What I was saying before was that a lot of our members, and I think just Americans in general, find applying for health insurance to be a very confusing process. So you walking us through that was very helpful. We also, again, as I mentioned earlier, appreciate your commitments to helping folks find truly affordable healthcare that comes with the bang, and provides real, true, good coverage especially through our New York City Health and Hospitals. So I do have a few questions from our members that I would like to walk through with you. They're very general questions that I think any individual could benefit from your answers. So just to start with the first one, let's say you're an individual who's covered through health insurance but loses their loses their insurance through the mid-year. Are they able to come to you in the summer, for example, and be able to sign up for healthcare at that time? Well, what are their options if they were not covered in the middle of the year?
I could take that.
Okay.
So if they lose their current plan, or if they're working and there's a reduction in hours, they lose their plan, that is a qualifying event. So that means if they don't enroll during the open enrollment period, if there's a qualifying event, like I said, loss of coverage or reduction of hours, they could then apply during the mid-year.
Got it. Is there any way, if you're someone sitting right now at home who is not covered, to be able to buy health insurance today and be covered from now to January 1st?
I'll take that question as well. This is the point right now. This is the open enrollment period. So this means that you don't need a qualifying event to enroll. So this is the time to either, if you don't have health insurance, to enroll yourself. This is the time to maybe add someone to your plan, your spouse, any dependents. This is now the time.
So if we were to buy into health insurance now, and we were, in the event we got sick next week or the next 2 weeks, would we be able to get coverage?
I'll take that one. So right now, the soonest you could sign up, if you're going to be getting a eligibility for essential plan or the qualified health plans we went over, the soonest you could sign up would be for January 1st, because the marketplace does enrollments on the 1st of the month, and they don't do retro enrollments. Now, if you're eligible for Medicaid, and you have a low income, I believe it's below 138% of the federal poverty level, you could potentially get New York State Medicaid that would start on December 1st.
Got it.
I'd like to also add, for scenarios where it gets a little tricky for people because they have to go through the enrollment process, then wait for the effective date, there may be an opportunity to go to our New York City Cares program within our health and hospital system. This program gives low-cost options for people who live in New York, and they give people a rated scale of payment until their coverage kicks in. So that's happening now across the city of New York at each of our health and hospital locations.
Got it. Thank you. Another question from our members. We do have a lot of folks who are health nuts. They go to the gym every day. They eat very well. They've adopted clean eating habits. Is there an incentive for healthy adults, healthy individuals? I think one of the issues that I think New Yorkers and Americans have is that, why am I buying health insurance when I'm a fairly healthy individual? I hardly go to the doctor. Maybe I'll go once a year. Is there an incentive for those folks? Are there subsidies for folks in that situation? Or is there a better option for them to buy into?
There's a couple of programs. I'll mention one. I'll let Brian or David touch the other. We have a gym reimbursement program that's available through New York City Health, and that covers both the individual and the spouse up to $250 per for the subscriber and the spouse every 6 months. So that's up to $500 a year. We also have a rewards program, and that incentivizes individuals to get preventive screenings, to stay healthy, and if for some reason they experience a chronic condition, to manage that chronic condition, there's also incentive programs as well.
Got it. So if I had a gym membership, I would get a $250 discount as an individual for the year?
Yes, every 6 months you can get discounted.
Okay, great.
Yeah, I also like to mention, 2020, as everybody knows, has been a rough year for everybody. This, even if you're a healthy individual and you don't go to the doctor and you never broke a leg, you've never been to hospital, I can't stress enough how health insurance is very important now, now in this pandemic era, and it's like car insurance, it's that what if factor, and it's really important to cover yourself and to cover your family.
Got it. Now, we're going to ask one more question. Telehealth is becoming widely popular, especially during this time. Look at us having this meeting on this call, on streaming for the public. I think people are deciding to stay home. We've seen the lines outside some of these clinics. They go wrap around the block because everyone's trying to get tested. There are people at home who want to avoid going into a clinic or into a hospital so that they won't get sick or so they won't overload the system. What are the options around telehealth using your insurance? Is it covered? Is it incentivized?
Yes, we have that. We have a program called Virtual Health. It's posted in our website, and it did launch earlier this year. With the plans for that happened pre-COVID. Fortunately, we had those plans put in place, and we launched it just before COVID. And when COVID hit, there was a lot of users, and so there was a huge benefit behind having that tool in place for our members. And we were very proud about that. So so yes, to answer the question, yes, that's available. That's probably the biggest tech trend in the health industry right now.
Got it. Final question. Sorry, I know I promised it would be the last one, but it's also a very important one given the moment that we're in. And as David mentioned, we're all sitting at home, right? And there's a lot of folks dealing with mental health, stress. Does the insurance cover mental health services?
Yes, our plan does cover that as one of the essential health benefits as mandated by the Affordable Care Act. So yes, that is covered under our plan.
Great. Well, thank you guys. I really want to thank you again for coming on and presenting to our members. I encourage anyone, if you're not insured or if you are insured and looking for a more affordable option, MetroPlus, I would say, is a company that the union stands behind. I stand behind as an individual as well, as a New Yorker. It's available to you if you live in New York City and the states of New York. So I encourage you, go to our website, freelancersunion.org. Click on MetroPlus, and you'll be able to see all of the different options that they offer. And as they walk you through, the process seems fairly simple and easy. And if you have trouble, just come back to this video. It'll be posted on our website so you can continue getting the guidance you need to apply for health insurance. So thank you again, MetroPlus. Thank you guys for coming on. We truly appreciate it.
Thank you very much, Rafael.
Thank you.
Thank you.
Okay.